How are you? So, hey guys, good to see everyone today. I'm Mike Patton. It looks like I'm going to be hosting today. Um, so we got Michele Wilfer. She is the Vice President of Client Services, Executive Vice President or Vice President,
Senior Vice President.
Senior Vice President, one of those titles. Michele
One of
handles all things client services related at Assured Benefits, who, as you all know, is our third-party administrator partner at Excel Health Plan. So, welcome, Michele.
Thank you.
You doing any Harley riding this weekend?
Absolutely. You know it.
Michele is a big fan of Harleys. Herself and her husband are big riders, so they try to get out as frequently as they can.
This is the right time of year. The weather's good.
Yeah, is it like October through, or like September through November is like the best time for you?
October, November, even December, a lot of times. It's Texas. I'm in Texas, so it's warm at the end of the year. It's good.
Very good. I mean, you can't complain about warm weather late in the year. Obviously, in Colorado, I went for my walk yesterday morning, and I think it was in the mid 30s, and you could see the frost out on the grass. Early in the morning when it's still a little dark out. So we get those temperature swings, even though it was still pretty nice, about 70 during the day. It gets really chilly overnight. But thanks for joining us today. I think what we're gonna delve into all things customer service today, as well as process and how health plans are constructed. And the great thing is Michele has a plethora of experience from working both at some TPAs, some big carriers. She has just a smorgasbord of experience in the benefit space. And so we're going to kind of get into that. Michele, if you don't mind, just kind of touch us through your background and how you got into employee benefits and really your journey in the space. So just start off with how'd you get into health insurance? I don't think not too many people try to get into health insurance.
Yeah, that is so true. And actually, it's funny you asked that because it's really quite a funny story. I won't go into too many details, but out of college, I actually took a temporary job bartending and met a gentleman there that was a regular customer who worked for Mutual of Omaha. So he actually hired me from behind the bar, and I went to work for Mutual of Omaha, and that's how I got into health insurance. So it was quite a interesting journey. But so yeah, so a lot of years on both the fully insured, most on the self-funded side. I've had over 30 years on the TPA side with self-funded business, all around client service, implementation, and working with clients and brokers and customers at all different types of industries and in all different areas of the country.
Very nice. So, and just to fill in for everybody in the space who hasn't been in there that long, Mutual of Omaha, I'm inferring at the time, did health insurance when you
Yes.
started.
Yes, large group medical insurance. So I actually worked for the Greater New York Group Office, where we did a lot of large group medical insurance. We also did a lot of stop loss business, which is how I got introduced to the TPA world. I helped manage all of our stop loss clients that we had with a major TPA on the East Coast, and had a lot of business with them and ended up going to work for them. And that's where I started my TPA world.
Okay. And then, so you left Mutual of Omaha to work for a third party administrator, and that was in what, New Jersey, right?
It was in New York at the time.
New York.
Mhm.
Okay. And so what was your first role at that TPA in New
So I
York?
was I was a service manager. It was a new small TPA. I was hire number 93 at that TPA, and I managed our client services team. I managed plan building. I managed plan documents. Um, it was the early onset of PPO network, so I managed network negotiations and contracting with PPO networks for us to build into our benefit programs. It was a lot of different types of administration, eligibility, COBRA administration was all part of my world. And then as we grew, it spread out, and became different areas within the organization, and I kept my focus on client management and implementation.
Got it. So with client management and implementation, what were you seeing? What were health plans doing back when you were working for that TPA?
That was a long time ago, Mike.
I mean,
A very long time ago.
hey, health plans were still health plans even
They
even in the
were,
80s and
they
90s.
were. Back then it was all about the PPO networks. Um, we got grandfathered in with one of the PPO networks in New York when I was there at the time, and so we were one of the few TPAs that had access to that network, and, it was we all know and love them. It was MultiPlan, and so we were able to build some really good business there utilizing the networks. It was still new to folks, so it was challenging yet interesting to share and have client members understand the PPO world and the fact that they could pay a copay and it wasn't just a deductible and coinsurance. So I think we've kind of come full circle, right, with high deductible health plans.
Interesting. Um, so your foray from there more into like the carrier side of things. Help me understand after you're working at this TPA in New York. Where's your next stop from there?
Next stop was that TPA was purchased and moved me to Fort Worth, and that TPA grew up to about 1,500 employees before it took a different direction itself. But I was at that same TPA for 16 years. Um, so again, a long time. And then moved along to another TPA local here in the Dallas Fort Worth area, where I was over all of implementation and had some um, insight, if you will, and some responsibilities related to just general client management, but predominantly was implementation as my number one priority there. And then moved over into a larger TPA owned by a carrier, where I was over the regional West region client management account executive team.
Got it. And so throughout your different experience in these two TPAs, what would you say? Let's start with just implementation rather than client services side. What
Sure.
would you say are the most important key things for benefits consultants out there listening to this podcast to be aware of in terms of what makes a clean implementation? Because we all know implementation can be critical to client satisfaction, retention, and then obviously the most important thing for everybody, which is member satisfaction.
Yes. Yes. And I think most of us know that, in this industry, if the implementation doesn't go well, it's very difficult to recover from that. Those things are never forgotten. I think we've all seen that. We've all experienced that. Whether whichever side of the business that you're working with, we all understand that, and it impacts all of us. So I think, it really is one of the most important pieces to the program is how it's implemented, making sure that the processes flow efficiently, making sure, I hate to use the word, and I won't. So making sure that if we can work with the programs that are available to us as they are, that really helps us. So I know, for example, working with Excel, the programs are very set, they're very organized. We've worked through a lot of those programs to make sure that as we implement them, we know the workflow, and that helps tremendously to keep things on track and to keep, bottom line, keep members happy. That's a key, I think, in implementation, because the bottom line is it impacts the members if it doesn't go well. And the members just want it to work. The clients don't want unhappy members coming to them with issues on day one. Um, Brokers and consultants don't want unhappy clients that may question the decision that they made to utilize their services. And as administrators and carriers, we don't want the brokers to be unhappy that they've chosen to do business with us. So it is that trickle effect, and it impacts all of us. And sometimes we lose sight of that a little bit. I've seen that too many times. I think we all have. But I think, one of the important things, and we've all seen it, day one, the first thing a member is going to want to do is have an ID card, be able to go to the pharmacy, get a prescription filled. So there's obviously a lot that goes on before that. And I think understanding those expectations and understanding the timing to get everything accomplished that gets us to that point where a member can go get a prescription filled are important. Um, so again, we all know fourth quarter is the busy time of year. So we want to be sure that we get things in as early as possible. We know it's not always possible. We accept that, but we want to encourage everyone just to set the expectations right from all the way down to the members. So if a client's going to make a decision, late, if you will, or later, closer to an effective date, it's fair to the members to make them aware that, look, we're changing healthcare plans. We're going to do our best to get everything in. We're running a little behind, but we'll make sure that you have the information you need to get your appointments with your providers, get your prescriptions filled. But if we can't get that information timely, we can't get that eligibility loaded, we can't get ID cards created. And again, fourth quarter, the volume is all that much more. So um, it's setting those expectations so that we can all work together to manage them as best we can.
Got it. So, how have you seen the health plans evolve from your first two TPA experiences? Like, what were you seeing from an implementation standpoint? Like, how are companies doing things differently as you were working? Especially mid 2000s. Like, how have you seen health plans evolve over the last 20-25 years?
Technology. Technology obviously is a big piece of that, right? So, like everyone else in society, information travels faster. So, I think, really, if you look to the past, people were making decisions. They were, filling in literally paperwork, getting all of that done. Sorry for the hand. I just had a bug in my face.
It's
Um,
all good.
but yeah, it was a slower process all the way around. Now, in this high speed society that we live in, we all want to see it faster. So it's getting information processed. I know with Excel, some of the pieces to our implementation and workflows have been really well automated so that we can get things in faster, easier, more efficiently, more accurately. Sometimes the faster we go, we lose some accuracy, so we don't want to do that either. But with standardizing some programs and standardizing the stack, if you will, the vendors we work with, it does help um, that implementation process. Years ago, I think there was less complication to a certain extent, to be quite honest with you, less outside vendors. Things were kind of all in one place, but that also does allow for some better um, adaptation to programs that are going to help the overall aggregate program, right? So we can plug and play vendors easier now than it was, I'd say, years ago.
So, and obviously this is from a macro level. I guess my question there is, has the healthcare inflation that we've seen over the last 20 years forced third party administrators to have to be more nimble because the the palette of a buyer for a program with all these cost containment features, I think that there's just more demand for that. So, I mean, well, what are your thoughts?
You're absolutely right. You're absolutely right. That has definitely driven the demand. Um, and it's that balance between the providers, it's the whole healthcare system, and I think we've all seen those challenges and how that's evolved and become, again, more complex in how do we keep costs down. Technology and modern medicine is great, but it's expensive, right? So costs continue to go up as um, different equipment, different treatments, different, hate to say it, medications come out into the market, they all cost money, the research costs money. So if we can better control those costs by putting in some of these unique cost containment arrangements, and Excel is a perfect example of a great way to do that, it will help clients overall.
So let's get back into when you were doing like large stuff for, kind of like carrier entities, and walk me through, because obviously you said you work for TPA and from by a carrier. Walk me through the process of like when you would customize things for very large groups. What types of things were you customizing for them? And what type of like installation timelines and rollouts did those customizations create for you?
Sure. So on the larger business there, most of our implementations, we would have at least 30 to 60 days to implement those. When it came to one new business, a lot of times we would have, you know, 90, 120 days, depending on the level and the size of those groups and how proactive they could really be. What did we customize? More or less in that world, plan design. So it's different deductibles, different requirements, but a lot also of cost containment with negotiations on individual claims. In some areas, we would do some direct contracting with providers. If it's a large enough group, they're going to have some pull in the community that they're in so that we could get direct contracts with facilities and provider groups. Saw that quite a bit on some of our, much larger accounts, um, cities, government, local public entities. Um, what else did we customize? Some network arrangements so that we, even being owned by a carrier, we had a primary network that we used, but we could, as a TPA, we still had that flexibility to engage with other PPO networks that may offer better discounts in a particular area. Um, we would engage more on the care management side, um, having case management and advocacy programs that were in place to help steer members to the best providers for the best cost that meets their needs. I say that carefully, not to say that they're always going to get steered to the cheapest, but they're going to get steered to what's going to best meet their needs from a medical perspective, from a healthcare perspective, and from a cost perspective as well.
Got it. Um, let's touch on that networking thing. What did you see that sounds like something that's really interesting. So when you're talking large, public employers, cities, county governments, they're able, what you're saying is to cut deals like inside of the carrier network with a particular health system or a particular facility or both. And what does that look like?
Yes, both. Yes, and again, depending on the size, when we had some pretty significant large cities, so obviously most of their members live in that city, so they had some, leverage with those healthcare systems, facilities. Even a local, close by cancer treatment center, for example. They could cut deals with providers like that. Um, we also saw some, not a lot, but some entities that would put in a clinic, if you will, either on their own property, where it was more controlled from a cost perspective and, not just to impact a member's health, but their access to care. So if they have a doctor's office right in the building that they work, it saves production time and from time away from work goes down. So was another little kind of caveat thing. Didn't see too much of it, but saw that a little bit.
So that's pretty interesting. So when they like were you involved at all in the cutting of these deals? And then how did the third party administrator go about creating and supporting and processing these types of
So they were very interesting. I mean, when you say arrangements, do you mean the direct contracts, or do you mean like
Yeah,
a okay,
like a direct
so
contract. Like I'm
yes,
City of San Francisco, not saying they were a client of yours, and I
they were
need to
not.
submit a contract with Sutter, as we all know, that probably wouldn't actually happen. So
Yeah,
let's just use a hypothetical that's impossible. That way, people can be sure that this isn't the real example. And I want to cut an arrangement. Well, I guess it's possible, right? Instead of paying 600% of Medicare, you could pay 500% of Medicare with Sutter.
yes,
So, so
yeah.
say we're going to cut that deal. How did your entity, how would you support that arrangement and operationalize it and make it so that way it would actually be accessible?
Sure. So honestly, we didn't get too involved in the actual contracting part of it. That would A lot of that was managed by the broker consultant and or in a lot of cases the clients. Again, these are larger clients, so they have their own benefits staff that's
Hmm.
what they do. So a lot of that contracting was done at that level. We would work with them just to make sure it's a provider that we can um, work with from a network perspective and not have any conflict with the PPO network themselves. Again, various situations all have various arrangements. Um, and then we would build the plan design to have tiers. So we, in some cases, had benefit plan designs that had 3, 4 tiers easily to address those provider arrangements, especially if it was a healthcare system. So tier 1 would be that healthcare system, tier 2, tier 3, changing in deductibles and copays and what the coverages were at the different tiers.
Okay, so I guess my question too is, right? Obviously, from a Buka carrier perspective, Sutter again, as we'll use this example, is contracted with Cigna or whoever
Correct.
this is. So what you're saying is that then there's a separate sub agreement with the health system, and you're saying, hey, if member X goes here, similar to what we're doing with Excel Health Plans, you're providing that member level incentive that they get a richer benefit of some form as a reward for going to the Sutter system versus going to the Stanford hospital system. If you're in, we'll just keep the
That
example in
is
Northern.
that is correct. Again, large group leverage. It was all
To have
yeah.
100,000 employees on your plan, right?
Maybe not quite that many, but yes, large numbers on the plan definitely helps with leverage for that. Because in most cases, honestly, the networks aren't going to allow it. They've already got those agreements in place. Um, they've already got good discounts in place. So it can be a challenge at a smaller scale um, to do that. I mean, it's not something that gets done broadly because the network arrangements and the contracts that the providers have with the networks will prohibit that.
Right. Um, so, from a claims routing perspective, how are you guys managing that to make sure that things didn't get screwed up there? Like
Sure.
that seems like that would be pretty challenging from the TPA's perspective of keeping track of.
All systematic, all done by tax ID number. So when those claims come in, they're identified by tax ID number, and that would dictate how those claims would be routed and how they would be processed according to what tier level of the plan.
Interesting. Okay. So, in terms of customization, now let's walk into, obviously you worked for a company owned by a carrier. What did the carriers do well from your observation in terms of standardizing things for efficiency standpoint?
That's a loaded question, Mike.
Well, I'm sure they have to do some of it well if they have as much business as they do.
Well, yes, obviously, but yeah, that's obviously yes. I think some of the things with the sales team. Here's your catalog of what you can sell, and here's the programs that go along with it. And those things that are outside that box, if you will, would go through a process of evaluation to determine what would it take to administer that program. Is it cost effective for the administrator? Um, to put that into place. How much more manpower will it take for us to do that versus this? Um, and then does it really benefit the client? Is there something else that we already have in place that may come to the same solution, that might provide the same solution, or might give them what they need, but we've already got it in place? It's time consuming to implement new vendors. It just is, right? And so if we so if we can find the right solution with something that we already have in place, that certainly makes things work more efficiently. Um, we all want volume of business, so it's efficiency that counts. But yes, they're definitely good at. I'd say we did a good job with that, and still be able to write enough business. We had good solutions in place, good packages that were already put together, that they could utilize. So it's just good selection, good vendor selection, and thus goes back to that reason for that evaluation. We don't want to put vendors into place that maybe a one-off, because this day and age there's a lot of them out there. Um, there's a lot of different folks wanting to get your business, and they have a solution, but there may be four others that have the same solution. So if it's administratively simpler to work with one versus another, that may be the right way to go. Some of them require more technological connection than others. Some want more um, complicated files sent to them than others. So we want to evaluate all of that before we begin working with the different programs.
So you brought up an interesting point in terms of, obviously there's a lot of vendors in the
There
space,
are.
but
There are a
yeah.
lot more and more
So
every day.
say we take any vendor in our program and we flip them out for another vendor. Help our benefits consultants understand like what that does to the TPA and to the other components of the plan. Let's just say pharmacy overlay program. Like let's chat about that. Say we just obviously everybody knows we work with script source, but say we have a benefits consultant who says, oh well, I have to work with sharks or one that we've never worked with before. What does that take? What does that lift look like from a third party administrator perspective, and then from a member experience perspective? Where can kinks occur?
Okay. Um, so kinks can occur. Setting up file exchanges for sure. um, Setting up file exchanges, learning what, if any, ID card requirements there are. Is there special plan language for a plan document? Do we have communications? We always, again, bottom line is the members, right? We want to make sure that the members can navigate their healthcare. We can pull in 10 different vendors and say you have to use this for this, and A for Z, and B for Y, etc. Um, but the more complicated you make it, the more difficult it is for a member to navigate, and a member is going to get frustrated. The member is going to air that to their employer. The employer is going to air that to their broker, and right back up the line. So we have to make it well communicated. We have to make it easy for the member to get to that care. Um, but again, going back to the implementation of some of those one-off arrangements, or a different arrangement, if you will, it does take time to understand, what's the billing arrangement, what's the technology needs, the ID card arrangement, plan doc arrangement, communications. Um, do we need to put a link on our member portals? All of those things, there's probably another 10 tasks that would be involved. But I think sometimes people lose sight of all those different tasks that are needed to actually implement a vendor. I wish, we could just flip a switch and, okay, sure, we'll use sharks instead of, script sourcing, or whatever the case may be. It's just not that simple.
Yeah, and I think one of the interesting things on that is just how much we've seen with building and scaling Excel health plans. We work with a couple PBMs, and it's exactly what Michelle touched on. We can have 10 different things that the members need to go here for this and this for that. And getting the member to there quickly and doing it in a manner that makes sense is actually pretty tricky. And because as we all know, the members got you've got about 45 seconds to educate the member during open enrollment. And a lot of these members who might need that care later in the year are unfortunately potentially unaware that they need that care during the open enrollment meeting. Obviously, we have everybody knows, we have the few people who know that they need to use their health plan during the year, and those are usually the people who actually pay attention in the open enrollment meetings and will absorb all the information because it affects them. The problem is the other 90% of the populace that it isn't in that scenario. And just by switching out, from our perspective, the pharmacy benefit manager is all, we've been working with a couple of them. That's created a lot of challenges just in terms of guiding the members to those vendors, in terms of keeping track of, okay, how do we systematize making sure that we know person is from group X, they have pharmacy benefit manager Y, which means, and sometimes the problem is that pharmacy benefit manager Y has a different prior authorization process and protocol than pharmacy benefit manager Z does. So we have to have our team adapt to those two things, and we have to have two totally separate processes in the steerage component of our plan, because we have two different vendors that we have to go to. So every time that we get told by somebody, hey, well, we need you to add a third thing, that route scope of all the potential options that we have in a plan becomes, multiplied by the number of our plan designs more complicated by adding that vendor. So it makes things, instead of triple as complicated, it makes it 18 times as complicated, because it has to be multiplied by the plan designs. And that's something that Michele has taught me, is that every time we introduce these concepts, we just have to be careful, because it creates potential room for error. So if you want to expand on that, that'd be awesome.
Sure. So, yes, it definitely does. I mean, we want to, even just from at that customer service level, right? Who's the member going to call when they're not sure what to do? Because Mike's right. You have 45 seconds um, at an enrollment meeting, and the majority of those folks are not going to remember it. They're not going to use it, and or they're not going to ask the questions until they have to use it. So they're going to call customer service, and if the plans are packaged in a good way, where the options and the different avenues that they have to go down to get to where they need to be are not too complex, they can be steered appropriately. But if we start making them unique and more complex between multiple programs, it becomes difficult, for customer service at the same time as well, not just the member. We want to make sure we're giving them accurate information, but when we have those twists in there, it makes it even that more difficult to help them find their best solutions. Is that what you mean, Mike? Is that what you were asking about?
Oh, sorry, I bumped my mute button.
That's it.
100%. That's really what we're looking for. And um, so taking that back to like your experience working for your carrier TPA, how do they do that well? And what lessons have you learned from working with, like, how the carriers do things that you applied to what your role is now, in terms of like standardization and keeping things simple versus needing to be custom, and
Yeah.
that balance?
Standardization definitely helps, but I think another big key component of that is just organization, keeping information organized, keeping things well documented, um, allowing our customer service folks to have well documented information that they can refer to while they're on a call. So obviously, you don't want to give them a book. They have books, obviously, plan documents, but you don't want to give them a book to read to find the answer for a member. They need, simple, concise documentation that will allow them to best steer the member where they need to be. Um, So I do think that organization is really key, and I have to say in my most recent prior employer that um, organization was a priority. We had a lot of really good resources, and you were able to find the information that you needed, and not just from customer service standpoint, from a client management standpoint, from a sales standpoint. Um, that was something that I will say was very well done. Um, and that is something now, we are working towards more and more of it. It's been there, but we're working to better organize the vendor information that we need, and um, just program information so we have the resources.
So, from that perspective, what would you say are lessons that our benefits consultants on this call can remember as we're going into fourth quarter when they're working with independent third party administrators? They're dealing with groups who want certain things. They want their plans to look exactly as they are now, or just groups being how does a benefits consultant whose primary balance point is I have a group who's demanding something X out of me, or I think I might need to accommodate their demand to win a piece of business, versus understanding what my TPA has to do when I ask them to do it.
Timing, timing, timing. So here we are, fourth quarter. Yes, we have multiple competing priorities. We obviously want every client to feel like they're important to us because they are. So we have to just, I think, keep in mind that as broker consultant A and broker consultant B, you both have those clients, and sort of six other brokers. So we have to remember that not everything can be a priority. So timing is so key during fourth quarter. Get information in as early as possible. It's only going to benefit the client to make decisions and get things in as early as possible, as complete as possible. As we get down into that crunch time, the faster we go, the more we open ourselves up for mistakes, and that's all of us. Um, so I think that is definitely something we want to keep in mind. If it's going to require a situation where the client is insisting, quote unquote, insisting that we have this program in place, or we're not going to be able to do that piece of business, maybe it's an education opportunity, right? To give them a better solution, um, and why maybe that's not the best solution for them. Or if they're continuing to insist that it is the best solution and it's the only solution for them, work with your as brokers and consultants, work with us, work with your administrators, work with your carriers, whoever you're working with, to, hopefully it's through Excel health plans, but work with whoever you're working with to respect their time and respect their competing priorities, and make sure that you vet out those programs and not just say, yeah, okay, we can sell it. Yes, we can do that, without making that confirmation before you do it.
That's well put. A timely no can be much better than a effed up yes.
Yeah. Exactly.
Um, let's see. So, interesting tidbit. I actually had one of our brokers text me rather than call us, but his question was, how efficient is the Buka provider hospital contracting process? Is it always a rubber stamp or with a percentage increase, or is it something more? I don't know if you have any insight in terms of like when you heard about contracts changing with health systems from your carrier days.
I would say, um, more often than not, when it comes to renewing those contracts, they just typed in that question.
Yeah.
Um, I would say more often than not, when just if it's just renewing a contract, they are a lot of times a rubber stamp. There are those one-offs with some of the health systems that tend to want to get into it every year or every contract period. And some of them are a little slower to renew than others. I mean, I can recall getting messages from our network team, saying this um, healthcare system or provider group is at risk of, dropping out of network. Or we got notice that they're going to drop out of network. And then, a month, sometimes 2 months later, here they are, they're back, or they're not going to cancel. They decided to renegotiate and we're okay. But I'd say more often than not, it's not that difficult to renew them. When it comes to new arrangements and new contracting with facilities, yeah, it's timely. It definitely takes a lot of time, time consuming. I'd say, 90 days is a minimum, in most of those cases. That's my experience. I'm not the expert network negotiator, but that has definitely been what I have seen when it comes to the bukas making those arrangements.
No,
Yes.
I think that's super insightful for us, Michelle. And I mean, like this, what we're doing, everybody out there with Excel health plans has definitely been a process. And this is another question from Jim, but I'll touch base real quick. But what we're trying to do with Excel is obviously take solutions that everybody knows works in terms of cost containment and systematize them in some of the same manners that the carriers have done. And people like Michelle and obviously our friend Amy have been really helpful at helping us understand things that the carriers do well to help us systematize these things so we can scale, so we can have volume where we can lower that unit cost of healthcare and make it easy for you all to distribute that. So that's really our goal at Excel.
Yeah.
So Jim's question says, do the BUCAs really put downward pressure on provider pricing? That's a good question.
Mm. Jim, um, I would say probably not as much as we would expect them to. How about that? That's kind of my thought, is probably not as much as we would expect them to. Again, I've not been the network negotiator in a very, very long time, but and certainly not directly with providers. Uh, Jim's laughing too, he says. Yeah, it's an interesting world out there, and that is definitely a challenge. Definitely a challenge.
Awesome. Well, I don't really have any more questions for today. Just kind of wanted to help brokers really look behind the curtain as to what does your world look like to actually put the plans together, because we know, not just on our plan specifically, but most of our benefits consultants are doing self-funded stuff with other administrators and maybe you guys as well, where they're doing their own custom one-off cases, and wanted to really help benefits consultants understand what it looks like for the people at the TPA, putting together all the solutions for you through their eyes.
Yeah.
So with that, Michelle, I'll kind of give you the floor if you want to throw anything else out there before we close it out today.
Yeah. I think just understanding really, again, timing, timing is key. And Mike gets tired of me hearing me say that, but it's the truth, because there's, always more to it. It's not, here it is, and will I have my ID cards tomorrow? No. So, it is definitely all about timing and just understanding that there's more behind the scenes than you realize. I wish it was as easy as flipping a switch for every program and every vendor and every need that we have, but it's not. There's work behind the scenes, and we just have to manage it well, especially with the volume that we see in fourth quarter. So we appreciate that.
Awesome, Michelle, and benefits consultants like you guys will hang out for another minute or two. If you have any more questions, feel free to throw them in the chat. But if not, we'll let you guys get out of here early.
Thank you all. Thanks for having me,
Thanks,
Mike.
everybody. Yeah, you got it.